hadir untuk memberikan kata-kata kepada anak-anak dari Unimu Semarang. Dipersilakan Dr. Yusuf.
Assalamualaikum warahmatullahi wabarakatuh. Selamat pagi dan good morning. Pertama sekali saya memanjatkan syukur kepada Allah dan selawat pada junjungan Nabi atas izin dan limpah kurnia kita bisa bertemu lagi hari ini. Saya ingin mengambil kesempatan ini untuk mengucapkan terima kasih setinggi-tingginya kepada Universitas Semarang yang sudi bekerjasama dengan Lincoln University College dalam acara pertukaran pelajar. Acara ini bukanlah satu perkara baru kepada kita, ini merupakan sambungan daripada program-program yang pernah kita lakukan dengan pihak Indonesia. Program ini memberi manfaat kepada kedua-dua belah pihak, di mana kita dapat bertukar pengalaman, bertukar pengetahuan, di samping mengeratkan hubungan persaudaraan. Saya harap apabila sempadan kita telah dibuka, program kita akan lebih memberi manfaat, di mana kita dapat bertemu secara person to person. Kerana komunikasi interpersonal komunikasi dapat memberi faedah yang lebih luas dan lebih mendalam dalam penyampaian dan persahabatan. Jadi saya sekali lagi mengucapkan terima kasih kepada Linatio yang telah bersusah payah mengatur program ini, dan juga dari pihak Indonesia yang sudi bekerjasama dengan kita. Semoga kerjasama ini akan berterusan dan kita akan berusaha untuk mempertingkat lagi mutu dan kualiti persembahan kita, supaya apa yang kita sampaikan ini lebih memberi manfaat kepada semua pihak. Sekian, wassalamualaikum warahmatullahi wabarakatuh.
Terima kasih banyak Dr. Yusuf atas kata-kata yang very inspirative kepada kita semua. Dari pihak Ibu Ida.
Ada gangguan.
Bu Dewi, monggo Bu Dewi, mungkin Bu Dewi bisa mengawal Bu Dewi. Tadi Pak Hanif sudah siap untuk memberikan sambutannya.
Ya, terima kasih. Saya izin Bu Ida, Pak Hanif belum join.
Iya, Bu Desi, monggo.
Ya, terima kasih. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Selamat pagi, kami ucapkan terima kasih sebelumnya kepada Dato' Ambasador Dr. Muhammad Yusuf as a Chief Executive Officer, kepada Dr.Ravi Kumar, the Head of the Physiotherapy, dan Dr. Linatio as a Marketing International. Mohon izin, nama saya Desi Aryana Rahayu, saya mewakili Prodi Keperawatan. Sudah disebutkan tadi di awal oleh Miss Lina bahwa pagi hari ini kami bersyukur bisa bergabung dalam kegiatan ini dengan melibatkan mahasiswa kami dari Prodi Nurse, Prodi S1 Keperawatan, dan Prodi D3 Keperawatan. Mohon izin, saya mewakili Kaprodi Nurse dan Kaprodi S1 Keperawatan, beserta Kaprodi D3 Keperawatan. mengucapkan terima kasih sebelumnya. Mudah-mudahan kegiatan ini bisa bersambung dengan kegiatan-kegiatan yang lain berikutnya dalam rangka meningkatkan kerjasama antara Lincoln University dan juga Universitas Muhammadiyah Semarang. Dan pagi hari ini kita akan menginisiasi Student Exchange Program dengan topik Antenatal dan Postnatal Physiotherapy for before and after pregnancy. Terima kasih sebelumnya kami ucapkan sekali lagi juga selamat datang untuk mahasiswa yang telah bergabung pada pagi hari ini. Mudah-mudahan kegiatan ini bisa bermanfaat dan terlebih lagi ilmu yang diperoleh bisa dimanfaatkan untuk sesama. Terima kasih. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Waalaikumsalam. Terima kasih. Kita mulai sekarang?
Ya, silahkan, Ms. Lina.
Okay. So today I would like to welcome all of you to join our students exchange program, as we call it, as our visual class for antenatal and postnatal physiotherapy by Dr.Ravi Kumarkata, our head of physiotherapy from Lincoln University College. Semoga ilmu yang diberikan hari ini, informasi yang diberikan hari ini oleh Dr. Ravi bisa bermanfaat, bisa memberikan pengetahuan kepada anak-anak mahasiswa daripada Unimus Semarang. Dr. Ravi, kita persilahkan. The floor is yours, Dr. Ravi.
Thank you very much, Dr. Lina. Good morning, all. Thank you very much to give this opportunity. Thank you, Datu.
Thank you.
My university.
You are welcome.
Thank you very much to Dr. Lina. So today I'm going to discuss about the antenatal and postnatal physiotherapy. So simply understanding, so what is the treatment plan before the pregnancy, during the carrying the fetus, and also after the delivery. So how we are going to manage the complication related to the woman's health. So please let me share my slides here. So before going to explain, just now you already watched my Lincoln University video, corporate video. So this is my main campus in Wisma Lincoln, located in Petaling Jaya. This is the medical campus, which is located in the Klana Jaya Learning Center. So in this topic, antenatal and postnatal physiotherapy, I'm going to cover the important topics, so which are related to the overview of the pregnancy, pelvic floor dysfunction, pregnancy-induced pathology, postural back pain, exercise for the uncomplicated pregnancy and postpartum, unsafe postures and exercise during the pregnancy, precautions, contraindications to exercise, pelvic floor awareness, and training and strengthening. So during the carrying, that from pregnancy, after the conception until the delivery, and also after the completion of the delivery, how we are going to manage the complication related to the woman's health, and also how we are going to bring them into the normal life after the delivery. So many complications they are going to face before the delivery and also after the delivery. Because of the physiological changes, some women may chance to get the pathological changes. So overview of the pregnancy and labor. So this pregnancy is very important to all the women, because during their life, therefore, the great attention is given to the antenatal care by the healthcare systems of the most countries. Because in every woman's life, this period is the very crucial and important thing. So if they're having any complication during the pregnancy, so with the physiotherapy, and also we are going to prevent the secondary complications related to the systemic changes. So if we see the pregnancy, so it is going to be the 40 weeks. So after the completion of the conceptions, so this pregnancy is divided into the 3 trimesters. So in each trimester, so is going to changes so many changes. So that means how the fetus is going to be improve the growth. So if you see the first concept in the first trimester, there's so many changes. So after the conception, the baby, the growth is going to be increased from the first month to the 3 months. So that means that is called the first trimester. So if you see the changes in the first trimester, so this is the very important period to stabilize the fetus growth. So if anybody having any complications, sometimes they may chance to get the abortions, some may chance to get the health issues to the fetus. So that is the reason this period is the very crucial. So in this period, we should not give any vigorous exercises and also vigorous physical activities. So this period is going to give the major symptoms such as the morning sickness and also fatigue, tiredness, and also frequent urination. So these are the most common symptoms the mother is going to face in the first trimester. So if you see the physiological changes, the first one is the implantation of the fertilized ovum. So after the conceptions, so that means after the ovum and sperm, the meeting after the time, so the implantation takes place in the uterus. So here the ovum and also sperm is going to be meet together. So after the 8th day, so it's going to reach to the uterus. So that means the implantation, the starting of the after so many changes. So after cell division and blastula, morula changes. So after 8th day is going to be implanted in the uterus. So after 8th day, so the baby is going to be increased day by day. So in this period, the mother is going to face so many symptoms such as the morning sickness, fatigue. So morning sickness means the vomiting sensation and also nausea and vomiting sensation, and unable to take the unable to take the food, anything, refuse to food. So here the mother is going to feel the fetus can kick and turn the head, swallow, and also in this first period, the baby is going to get the heartbeat. So that is the reason the first 3 months are the very crucial. So in this period, our advice is very, very important to avoid the secondary complications. So because of the physiological changes, the mother is going to get the body size is going to be increased, especially the breast size is going to be increased. So coming to the second trimester. So in the second trimester, it starts from the 17th week. So then it's going to the 29th week. So here is going to be the mother begins to feel movement around the 20th week. After reaching the 20th week, the mother is going to feel comfortable. The morning sickness is going to be disappear. The vomiting sensation, fatigue. So these symptoms are going to be disappear. So by the end of the 19th and 20th week, the baby size is going to be increased. So from the it's going to reach to the 14 inches length, and also weight approximately is reached to the 600 grams. So in this period, the fetus is going to get the special the organ developments, and also others are going, eyebrows, eyelashes are going to be developed, fingernails also going to be developed. So if we go to any scan, or TIFA scan or any 3D scans, so we can clearly see these fetus eyebrows and also eyelashes, fingernails during the TIFA scan period. So if you see the third trimester, so in the trimester, so the growth will be more in the last period. The uterus is now very large and has the regular contraction felt, and also they feel is the regular contractions. So that means because of the fetus growth, the uterus size is also going to be increased. And also frequent urination, back pain, leg edema, fatigue, and also round ligament pain, and shortness of the breath, and also constipations. So because of the fetus growth, they may chance to get the postural abnormality. So because of the postural abnormalities, may chance to get the back pain and also sacroiliac joint pain. And because of the pressure, and also they may not chance to get the fetal movement, and also they may not chance to get the a defecation properly. It may lead to the constipation, either because of the improper diet, or because of the iron supplements, or because of the improper movements in the intestines. So by the end of this third trimester, the baby size is going to be increased, is 39 centimeters long. the length of the baby, height of the baby is going to be the 39 centimeters to the 50 centimeters. So it depends upon the genetics. And also the baby weight is going to be the 3.5 kilo. So that is the normal ideal weight of the baby. But sometimes because of the abnormality of the diet and also maybe any health issues to the mother, the baby may chance to get the weight gain. Mother as well as the baby may chance to get the weight gain due to any diabetes mellitus or any other health issues. So after the third time, that is 40th week, the baby is going to comes outside. That's the baby, mother is going to deliver the baby. So these are the overview of the pregnancy. So it consists of 3 trimesters. So each trimester consists of the 3 months. So if you want to discuss all the details, the time is not enough here. So just I'm going to end up with the overview of the pregnancy. I hope you understand clearly. If you have any doubts, we will discuss in the question and answers in the period. So the weight gain is the most physiological changes during the pregnancy. So the normal weight gain, so during the pregnancy from after the conception until the 9th month, so minimum 9 kgs to the 15 kgs is this is the normal weight gain. If it is more than the 15 kgs, it is considered as the overweight and also obesity. But it is not similar to all the patients. So, but this weight distribution is most commonly seen in the different places, especially the fetus weight is going to increase from the 3 kg to the 4 kgs or 3.5. This is the normal weight gain in a healthy baby. And placenta weight gain due to because of the increase the placenta and also the hormonal changes. So it is until from the 0.48 to the until less than 1 kilo. Amniotic fluid is going to be increased less than 1 kilo. Uterus and breast size is going to be is the 2.5, and also blood and fluid is going to increase is the 4 kilos, and muscle and fat is going to be less than 3 kilo. So totally will be is the 9 kilos to until the 15 kilos. This is the normal weight gain during the pregnancy. So it is not similar or not same to all the women. So it may chance to vary to the person, depends upon the intake of the food, depends upon their health status. So it may vary the weight gain. So if anybody getting the weight gain less than 9 kgs also, it won't be like an effect on the health, but we have to check where they're having the problems. Is it because of the nutritional deficiency or because of any like a fast metabolisms? So we have to know where they're having the problem. So this is about the pregnancy weight during the pregnancy period. So in this pregnancy, so many physiological changes. So physiological changes, not only in the musculoskeletal system, each system is going to change. So all changes we can observe, but here I'm going to concentrate on the musculoskeletal system. So most of the musculoskeletal problems are going to handle by the physiotherapists and nurses and caregivers. So that is the reasons, at least we have to understand all the musculoskeletal problems. Is it clear? Am I going very fast or can I go slow? Is it okay?
Okay, doctor.
Okay, thank you. So if we see the changes in the musculoskeletal system, so these musculoskeletal systems are going to be, especially the muscles. So these, especially abdominal muscles and also back muscles and thigh muscles are going to be more affected. So all muscles are going to be involved because of the postural abnormality. So if we give the postural re-educations, so we can prevent the postural complications. If you see the abdominal muscles is particularly rectus abdominis muscles. So because of the weight gain of the fetus, so the belly is going to be increased. So because of the belly increasing fetus growth, and these muscles, especially the abdominal muscles, are going to be stretched, and also it may chance to get the laxity because of the increase the hormonal changes. And also the pelvic floor muscles because of the anti-gravity positions. So the pelvic floor muscles are going to be overstretched during the pregnancy, vaginal delivery, and also during the pregnancy period. So it may lead to the pelvic floor muscles become weakness. And connective tissues and joints. So the hormonal influence on the ligaments, it may produce the increasing the laxity of the ligaments. So especially the relaxin hormones and also progesterone hormones. So it may these because of the changes in the relaxin and also progesterone hormones. So these ligaments are going to get lax. So that means a weakness. So there is no stability in the joints. So because of the laxity of the ligaments, so may feel the back pain and joint pains, sacroiliac joint pains. So because of this relaxin and progesterone hormones, so it may chance to get the joint hypermobility. So occurs as a result of the ligament laxity and may predispose the patients to injury, especially in the weight-bearing joints such as the back, pelvis, and lower extremity. So that is the reasons women may chance to get the pain and discomfort in the joints as well as soreness in the muscles. So because of these hormonal changes. So coming to the postural changes. So postural changes. So if you see the normal posture, so if you put any plumb line, if you draw a line, it should be crossed from the center of the ear. So that means the ear lobule, and also should be crossed from the shoulders and hips, and it comes to the ankle. So this is the normal posture. But in case of the pregnancy, so because of the growth of the fetus, our structures, especially the curvature of the spine, so this is the kyphotic curvature and lordotic curvatures are going to be altered. So especially this lumbar curvature, lumbar lordosis, cervical lordosis is going to be increased because of the postural changes. So because of the changes in the posture, so these muscles, especially these abdominal muscles and also the back muscles are going to changes in the structure. So especially these abdominal muscles are going to be lengthened. This back extensor muscles are going to be the shortened. So because of the changes in the size of the muscles, so it may alter the posture. It may produce the back pain as well as it may produce in the mid back pain because of the shoulder abnormality or because of the shoulder blade protractions. So the shoulder girdle and upper backs also become rounded. So because of the changes in the breast size and also the heaviness of the breast, so it may pull the breast size forward. So this muscles becomes tight. So because of the pulling of this pectoralis major muscle and minor muscles, so the shoulders are going to become rounded. So these shoulder blade muscles are going to be weak. These chest muscles are going to become tight. So because of the tightness of the chest muscles, so it pulls the shoulder forward. So the shoulders have become rounded shoulders. So because of the roundness, so they may chance to get a discomfort or may chance to get pain in between the shoulder blades. So it may produce the mid-scapular pain. So these are all because of the changes in the posture. So if you see the changes, especially just now we discussed, you can see because of the heaviness of the fetus and because of the heaviness of the breast, the total posture is going to be altered. So because of the weight, so this pulling of the tightness muscles, that is pectoralis muscles, and it may lead to the shoulder blade muscles are going to become weakness. So because of the shoulder blade muscles and also weakness and tightness of the pectoralis muscles, so they may chance to get the rounded shoulder. So suboccipital muscles respond is a effort to maintain the appropriate eye level. So suboccipital muscles means nothing but the neck muscles also going to get the tightness. So because of the extension or because of the lordosis posture, so it may change the eyesight. So the way of the pattern of the looking patterns. So and also because of this weight of the fetus and also altering the posture, the center of gravity. So the center of gravity is going to shift it posteriorly. So because of the changes in the posterior changes of the center of gravity, so it may lead to get change the posture at the pelvic region. The pelvic is going to be tilted. So it may lead to the tightness of the lumbar extensor muscles, that means low back muscles, and tightness of the hamstring muscles, that is the back of the thigh muscles become tightness. So it may produce a tilting and abnormal posture. So it may lead to the back pain in the mid lower back pain, as well as they may chance to get the discomfort in the thigh regions. So these are the changes because of the altered posture. So how to avoid these complications? So if we give proper awareness to the mother, so we are going to, if they maintain the posture, in the correct posture during the sitting and standing and during walking time, so at least they can prevent these complications. So especially we have to give the awareness about these tight muscles, so they can at least they can understand where they are getting the tightness and where they're getting the weakness. So according to them, so if we give the some like exercises, if they practice, we can prevent these complications. So coming to the balance. So just now we discussed because of the postural abnormality, so the balance also going to be changed. So because of the relaxin hormone, the ligaments are going to get the weakness, as well as because of the tightness of the muscles, and also going to changes in the pelvis. So it may lead to the external rotation of the hip. So because of the pelvic tilt. So because changes in the pelvic rotations, so their physical activities, such as the activities of daily living, the stair climbing, and also standing, walking forward, or maybe the forward moving. So these activities are going to be a bit challenging if it is grows in the third month, in the third trimester. So activities requiring the fine balance and rapid changes directions, such as aerobic dancing and bicycle riding, so may become inadvisable, especially during the third trimester. So that is the reasons. So they may change to get the balance problem after reaching the 7th month, 8th month, because of the increasing the fetus growth. So this period, we should not encourage any aerobic activities, any vigorous exercise. It may lead to any falls or in an imbalance. So it may give the further complications. So whatever we give the exercises, aerobic exercises to maintain the mother health as well the feet and baby health. So we can encourage the mild to moderate aerobic exercise during the 3rd month and also after reaching the 2nd trimester. But we should give some precautionary measures during the 1st trimester and also 2nd trimester. So coming to the pelvic floor muscle dysfunctions. So our role is very, very crucial in the pelvic floor dysfunctions. So if we see the pelvic floor muscles, so because of the fetus weight and also because of the anti-gravity of these muscles, so it may stretch these pelvic floor muscles. So if you see the pelvic floor muscles, so these muscles are going to be in the 3 layers, superficial layers, and also the diaphragm and the urogenital diaphragms, and also pelvic diaphragm. If you see the superficial muscles are, so ischio-cavernous, bulbo-cavernous, and also superficial transverse perineal, external anal sphincters. So if you see here, so these are the ischio-cavernous and also bulbo-cavernous. So here, these muscles are going to be, so is going to be the vaginal muscles. So these, sorry. So these pelvic floor muscles, because of the anti-gravity and also during the vaginal delivery, these muscles may become overstretched and may chance to get the weakness. So if you understand about where is the location of these pelvic floor muscles, so we can give the strengthening training if they're having complication related to the pelvic floor dysfunctions. Just here I'm showing where the pelvic floor muscles is simply understanding the muscles surrounding to the vagina and also muscles surrounding to the anus. So these muscles are very important. So after during the pregnancy as well as after the pregnancy, because overstretching of these muscles may lead to urinary incontinence or maybe fecal incontinence. If the muscles are not functioning properly, so it may produce the incontinence. Incontinence means leakage. They may chance to get the urine leakage and may chance to get the fecal material leakage. So that depends upon the severity of the muscle weakness. So how we know the severity of the muscle weakness? So we have to check how much of time they are going to hold the urine. So if anybody having any urinary incontinence, so we can give some water, ask them to get the bladder fullness. Then we can ask them to hold how much time they are going to hold the urine. So if it is severe weakness, so immediately they may chance to get the urgency or they may chance to get the dress wet or the cloth wet. So these symptoms we can observe. So we can identify the severity of the weakness and we can train before the pregnancy, before the delivery, and also as well as after the delivery. So who are going to get the more like a muscle weakness in the pelvic floors? So the risk factors, especially the childbirth. Childbirth is obviously most significant risk factor for the pelvic floor impairment. So especially the labor process, during the labor process, or if any get any trauma during the labor or during the delivery period. So that means during the second stage of the labor. So if you see the stages of the labor, in the second stage of the labor, so the mother has to put more effort and also has to push the baby out. In those times, so the mother has to put more pressure on the pelvic floor muscles. So it may lead to the like a trauma to the pelvic floors. So it may damage to the pelvic floor muscles. Sometimes if any mother having the difficulty in the delivery, so because of the baby, the big head or the birth canal is small size, sometimes the mother cannot push the baby out. So the pregnancy time is going to be longer duration. The labor will be the longer durations. So because of the longer durations, the surrounding muscles, the vaginal muscles, the pelvic floor muscles are going to overstretch and may damage. It may lead to the tears of the perineal muscles. So it leads to the muscle weakness. And also other causes are so who are getting the multiple pregnancies. And also multiple pregnancies, some women may chance to get the twins, triplets, and quadrets. That means 3 babies, 4 babies, sometimes. So because of the weight of the fetus, the muscles are going to be overstretched. So it may lead to the weakness, and also it may produce the muscle weakness and also incontinence. Other than these factors, and also other risk factors are who are taking like a smoking, who are smoking, or who are having like a alcohol, the high intake of the alcohol, or if anybody having severe constipation, that is a chronic constipation, or any cough during the pregnancy, if any respiratory infections. So during the respiratory, during the pregnancy, if anybody gets respiratory infections while coughing, so the more pressure will be in the pelvic floor muscles and also abdominal muscles, so may chance to get the more weakness. And also obesity and hysterectomy, so these risk factors may produce the pelvic floor dysfunction. And also another causative factor is a high caffeine intake. So high caffeine, so it's at least 3 to 4 cups of the coffee is is it recommended for the mother? But if it is crossed more than like 4 to 8 cups, so it may increasing the caffeine percentage, so may chance to get the other complications related to the caffeine. So better we can ask them to try to avoid the more than 3 cups of the coffee during the pregnancy and also after pregnancy. And also what are the effects during the pregnancy? So it's the effects especially of the childbirth and the pelvic floor. So majorly the neurological compromise, so such as the pudendal nerves. So mainly is the pudendal nerve is going to be overstretched. So this pudendal nerve mainly supplies to the surrounding the muscles. So these pudendal nerve may chance to get the overstretch. So because of the overstretch of the pudendal nerve, so it may give the discomfort and also pain, tingling, numbness sensation in the perineal and also pelvic region. So muscular impairment. So extreme stretching of the pelvic floor tissue is inherent in the process of labor and also vaginal delivery. So who are going to the vaginal delivery, that is nothing but normal delivery. So because of the small size of the vagina or the birth canal or big size, if the fetus head is become bigger size, so very difficult to push the baby outside. So during this process, so it may chance to get the overstretching of these pelvic floor muscles. So it may chance to damage or it may chance to get the more weakness. So during the delivery, if the mother is not able to push the baby properly, so the physicians or doctors are going to do the small incision at the vagina, so towards the anus. So this process is called as the episiotomy. So depends upon the baby, depends upon the baby position. the physicians or doctors are going to do the incisions. So either medial and also is a lateral. So depends upon the incision they are going to do. So these incisions are going to be during the delivery time. So it's very important. So after the delivery, our role will be more in the episiotomy. So may chance to get the infections and also may chance to get the incontinence, and also healing also may difficult if anybody having the diabetes. So in that particular time, our physio role and also nurses role are very crucial to avoid the complications surrounding to the birth canal. So these are the changes and also some problems during the antenatal period. And also what is our role during the antenatal and also postnatal period? Is it clear, or do you have any doubts here? Can I continue, or do you have any doubts?
Yeah, you can continue, Dr. Ravi.
So coming to the antenatal care, so what is the importance of the antenatal care? So during the pregnancy and also the development of the fetus, the mother is going to feel so many complications, such as just now we discussed the muscle tightness and also ligament laxity and also back pain, and also they may chance to get the varicose vein. So it depends upon the problem. So they may chance to get the symptoms. So our role is to give the healthy mother and also healthy baby. So until the completion of the delivery process. So that is the main aim of the antenatal care. So role of the physiotherapy in the antenatal care. So just now we discussed they may chance to get the musculoskeletal problems. So we are going to avoid the musculoskeletal problems and promoting healthy lifestyle. So they may chance to get the weight gain and also changes in the shape of the body. And also, so we are going to improve their healthy lifestyle with the awareness of our exercises and diet and also postural ergonomics. And postural and also ergonomic advices, preparing for the labor. So during the labor, before going to the labor, so they may chance to get the anxiety and also worriness about the labor. So if we give the awareness and also give some relaxation techniques, so these relaxation techniques and also the muscle relaxation through the hard pack and also some positionings. So these hard packs and also positionings are going to be helpful to give the easy delivery process. Teaching relaxation techniques and also optimal physical fitness. So we are going to maintain the fitness and also we are going to provide the relaxation techniques during the delivery. And also we have to give some guidelines during the antenatal care. So these guidelines are very important. So everybody want to know about the exercises and also in which exercise are going to be harmful and also is beneficial. Some positions are not suitable during the pregnancy. So for example, if anybody get any back pain or any sacroiliac joint pains or any a mid back pain, so we should not give such positions in the supine lying position continuously more than 5 minutes. So if we give the supine lying position, so continuously more than the 5 minutes, so may chance to get the vascular compressions, such as the inferior vena cava compressions may chance to get. So because of the compression of the inferior vena cava, so it may alter the heart functions. So it may chance to get the heartbeat is going to be altered. So in this position, we should not encourage the exercises to avoid the complications such as the Valsalva maneuver, and also we avoid the complications related to the heart functions. So if you want to give exercises, anything in the supine lying positions, so we have to take measures. So that means keep one small roll of towel roll, so towards the right side. So if we keep the small towel roll towards the right side, so we are going to prevent the compression over the inferior vena cava. So if we give this roll, so we can prevent the compression of the abdominal muscles, so we can prevent the Valsalva maneuver. And also while giving the exercises, we should not encourage the patient so with vigorous exercises, and also they should not allow to hold the breath. So if they hold the breath, so they may chance to get the like a Valsalva manner. So that means they're going to put the more pressure on the abdominal muscles and also internal organs as well as the pelvic floor muscles. So we should not encourage the breath hold during the exercises. And before the exercises and also after the exercise, we have to encourage them to the before the exercises, we have to ask them to do the warm-up exercises, and also after completing the exercise, ask them to do the cool down exercises. So if we do this warm-up exercise and cool down exercise, so they may increasing their activity and also prevent the complications related to the cardiovascular dysfunctions. And also while giving the exercises, we have to encourage them to take some breaks for the water intake. So these breaks are going to be helpful to prevent the dehydration. And also before going to the exercise, we can ask them to go to the toilet to empty the bladder. So if they do without emptying the bladder, they may chance to get the dripping during the exercises. They may chance to get the a frequency or urgency because of the pressure over the pelvic floor muscles. And also we have to give any exercise, modify exercises if they're having any pain or discomfort in the back or in the fetus or in the abdominal regions. Limit the activities in which the single leg weight bearing is required, such as the standing and also leg kicks. So in case of sometimes if the standing continuously, they may chance to get the pressure in the lower back. So ask them to change the activities and modifying the activities. So if they're having any a discomfort or any balance problems, so ask them to do with support or in the proper sitting positions or standing positions. So these are going to prevent some discomfort around the back as well as the symphysis pubis. Okay, coming to the main important complications during the antenatal. So this and also postnatal. So first one is the pregnancy-induced pathology. So because of the pregnancy, the mother may chance to get the diastasis recti. So diastasis recti means nothing but if you see these abdominal muscles are the rectus abdominis muscles. You can see all the abdominal muscles. So is a transverse abdominis. So that means from the vertically move from the sternum to the pubis. So you can see if the growth is increasing, so these abdominal muscles are going to be separated. Normally, these two bellies, this is transverse abdominis and also right and left. So these are going to be joined with the linea alba. So because of the fetus growth, so this is going to be increasing the separations. So this is without the diastasis, there is no separation of the abdominal muscles. Coming to if you see here, the separation around the umbilicus, and here the separation below the umbilicus, this above the umbilicus, and also the rest along the full length of the linea alba. Linea alba is nothing but the line between these is two muscles. These are two muscles are going to join with the linea alba. So because of the weakness of these abdominal muscles, so these muscles are going to be separated. So these muscles, if they're separated, so they feel the more discomfort, more weakness. They're unable to maintain the posture naturally. So how we can give the significance about the diastasis recti. So that means, so ask them to lie on the supine lying position. So ask them lift the head forward and also lift it head and also shoulder elevation. So if they keep the two fingers below the umbilicus and also above the umbilicus, if they feel any separation of the muscles, so it is the significant separation of the diastasis recti. So this diastasis recti may occur in the pregnancy as a result of the hormonal effect on the connective tissue and also biomechanical change in the pregnancy because of the posture, because of the hormonal changes. So they may chance to get this diastasis recti. So and also during the labor, so in the prolonged holding of the a breath holding, so also may chance to produce the diastasis recti. So it can occur, just now discussed, the surrounding to the umbilicus, below the umbilicus, above the umbilicus, or is completely along with the linea alba. So these things, so we can ask if you want to check who are having the muscle weakness or muscle separations, So we can do in these positions, ask them to do the supine lying positions. So if we keep the 2 fingers is a horizontally, so we can get the separations. So it indicates or it gives the clear significance of the diastasis recti. So how we can avoid the diastasis recti? So if we give the proper precautionary exercises, so before the delivery, so if we give some strengthening exercise to the obliquous muscles and some strengthening to the abdominal muscles, so we are going to prevent these diastasis recti. So if we check the supine lying positions or the hook lying positions, nothing but is the bending the knees and also hips together, 90-90 pose. If we keep the 3 fingers, so if it is more than 2 fingers, it indicates the significance of the weakness of the diastasis recti muscles. So how we are going to manage the diastasis recti? So how we are going to teach the exercises? So especially teach the patient to perform the corrective exercise for the diastasis recti, exclusive of the other abdominal exercise until the separation is decreased, that is until the less than 2 centimeters. So we have to give the exercises, especially the surrounding to these abdominal muscles, those muscles are called as the obliquous muscles. So if we give the strengthening to the obliquous muscles, that is internal oblique and external oblique, so we are going to prevent this diastasis recti, like make the weakness in the rectus abdominis. The rationale for this that due to the angle of attachments of the obliques into the linea alba, so there is a possibility that is trunk rotation exercise will incorporate the separations. So that means if we strengthen these obliquous muscles, so we can prevent the separation of this linea alba. So how we are going to strengthen these exercises, I'm going to show the further slides, next slides. So main important, so we should not concentrate on the abdominal muscles because the fetus growing time, so we should not encourage the abdominal muscles because of the fetus may discomfort and also mother also feeling the discomfort if we give any abdominal exercises. So instead of abdominal exercise, we have to concentrate on the core muscle exercises, especially these are oblique muscles. I'm going to show what are the best exercise to prevent the diastasis recti in the next slides. So coming to the postural back pain. So postural back pain, so just now we discussed because of the postural abnormality and also ligament laxity and also abdominal muscle weakness, it may produce the postural back pain. So the mother is going to complain, so pain around the lower back and also pain may around the buttocks region and also thigh region. So this back pain usually worsen with the muscle fatigue from the static postures. If they stand continuously, if they sit continuously, so it may lead to the severe pain around the lower back. So the symptoms are usually relieved with the rest and changes in the position. Women who are physically fit generally have the less back pain during the pregnancy. So who are planning for the pregnancy, so if they fit, so they won't get much complications related to the back pain and also muscle problems. So fit means if they changes or if they correct their posture and also they follow the postural ergonomics, so we can prevent the postural back pain and also we are going to prevent the sacroiliac joint pains. So the intervention, the treatments for these back pains effectively with the many traditional low back exercises, the proper body mechanics, postural instructions, improvement in the work techniques, along with the superficial modality applications. So we have to give how to sit and also how to stand during the pregnancy. So because of altering the posture, sometimes is going to get the more arch in the back. So if they're standing continuously, so they have to change the leg positions. Where to put the other leg on any step or any stool if they stand continuously. Or if they feel any muscle aches or any pain, we can give some superficial modalities such as the hard packs or maybe ice packs. So these are going to be helpful to releasing the muscle tension and reducing the back pain. And also some exercise, some electrical stimulations are such as the TENS application locally. So these are going to be improves the blood circulation to the particular muscles. So it will help to reducing the back pain. And also some exercises, especially we can give some ball exercises and some simple stretches are going to be helpful in prevention and also management of this low back pain. So these are especially the anterior and posterior pelvic tilt. So we can use this ball, also called as exercise ball or gym ball. So with the using of this gym ball, after sitting on this ball, so do the movement, forward movement and also backward movements on the ball. So it's going to gives the mobilization to the pelvis. So these are going to be helpful to reducing the tension in the pelvic floor muscles and also back extensor muscles. It will help to reducing the back pain. Pelvic hike, right and left. Pelvic hike means if you sit here on the ball, so this position, we can ask them to tilt the pelvis towards right side and left side, moving towards these positions are going to be helpful to mobilize give the movement to the pelvis. So it's helpful to maintain the ligaments and also muscles flexibility. And also tighten your abdominal muscles and also should not hold the breath. So here we can ask them to, in the sitting positions, try to pull the abdominal muscles. That means ask them to hold pull the abdomen towards the spine. So these activities are going to give a contraction to the abdominal muscles and also core muscles. Will help to improve the strength in the abdominal muscles as well as the core muscles. Contract the gluteus with the gluteal muscles and also bridging. So in the supine lying positions, so if we ask them to do the bridging positions, so these positions, so these bridging positions, so these exercises are going to be helpful to improve the strength in the gluteal muscles and also the pelvic floor muscles. And also other exercise, the cat and camel exercise. These cat and camel exercise are going to be the quadruped positions on the knees and hands. Ask them to do the move forward and backwards, the back lifting. I'm going to show what are the exercise. Pelvic hike in the quadruped positions and also baby pose. So these stretchings, these are the baby pose. And also lean over the ball. So these positions are going to be gives the relaxation to the lower back muscles and also pelvic floor muscles. So these exercises are going to be helpful in reducing the back pain, lower back pain. And also other complications such as the sacroiliac joint pain or the girdle pains. Because of the continuous standing or improper sitting, it may produce the stress on the sacroiliac joint over the sacrum and also hip joint. They may chance to get the pressure. So it may give a micro trauma and also it may produce the pain around the sacroiliac joint. So these are going to be localized to the posterior pelvis and described by the stabbing deep into the buttocks region. So because of the discomfort in the sacroiliac, the pain will come to the buttocks region. So the pain may radiate to the posterior thigh, knee, but not into the foot. So the pain they are going to complain in the thigh region, buttock region. So it may worse during the continuous sitting position or standing positions. So because of the continuous postures, it may increasing the pain in the buttocks region and also thigh region. So the major, while climbing the stairs, turning in the bed, and also unilateral standings and also torsion activities, so the symptoms are going to be worse. So symptoms may not be relieved by rest and also frequently worsen with the activities. If they do any activity, the pain is going to be increased. The normal back pain, so if we apply any hot pack or any ice pack, cold packs, they're going to get the relief. But these sacroiliac joint pains, it's not going to get the relief. So the pubic symphysis dysfunctions may occur alone or combination with the sacroiliac symptoms, and also including the significant tenderness to palpation at the symphysis, radiating pain into the groin, medial thigh, and also pain with the weight bearing. If they sit or standing where they're getting the weight bearing, so those areas are going to get the more pain. So how to prevent the sacroiliac joint pain? The pelvic girdle and also sacroiliac symptoms are treated via modifications. So we have to give some positions. So, and also we have to give some exercises so we can prevent this pelvic floor or the sacroiliac joint pains. So especially the stabilization exercises are going to be helpful in prevention of the SI joint pain. So these are especially the some activity modifications. So these activity modifications, especially while traveling, so while entering into the car, so how to sit, how to get out, and also get in, so we have to encourage. So first here, we can ask them to, while entering into the car, get into the car, so ask them to first put their buttocks first. That means while sitting, first they sit and then bring their legs first. So then they're going to get the much less pressure on the SI joint. While getting out, first they have to keep the legs outside. So then only they have to get the outside. That means they go outside. And also some lying positions have to maintain the position properly in the side lying with the support of the pillows between the legs, and also support to the fetus in the abdominal region. So these placement pillows are going to be helpful to pressure on the SI joint, and also it will help to reducing the SI joint pain. So, and also always keep the one pillow between the two knees. So these are going to be reduce the stress on the iliac and also pelvis as well as the sacrum, and also helpful to reducing the SI joint pain. And also some positions, especially we should not encourage the open hips. That means the hip abduction position should not encourage. Always the legs should be closed, adduction positions. If they do the abduction positions, so the pressure is going to be more in the SI joint. So we should not encourage the hip opening positions. If some activities, if we change, are during some sexual positions, or such as so that means always should be the hip adduction positions. So this is from the sexual position from the back side. So in the always hip adduction positions. So these positions are going to be helpful in prevention of the SI joint functions. And also other complications such as the varicose vein. So these varicose veins, especially who are having the any venous insufficiency, any veins abnormality, any dilatation, so they may chance to get the varicose vein. So these varicose vein nothing but is the abnormality in the venous system. The veins become the bigger size, larger size. So the veins may chance to distend it in the legs, in the lower regions, lower legs, or in the thigh regions. Not only in the legs and thighs, they may chance to get in the vaginal and also anal region. The veins become dilated. The veins become in the bigger size. So these conditions are more commonly seen associated with the pregnancy. So the varicose vein characteristics are going to be, this can present in the first trimester and also more prevalent with the repeated pregnancies. So if the multiple pregnancies, so if they go to the 5th pregnancy or 6th pregnancy, some in many countries, so they may chance to get the vein distension. The vein dysfunction is because of the dysfunction may chance to get this abnormality in the venous system. So this how we are going to prevent this varicose vein. So who are having this abnormality, they may chance to get in the anus distension. So these are also called as the hemorrhoids, or in the vagina uvula. So they may chance to get the uvular like a varicose vein. So these complications we can prevent with some supportive devices such as the elastic supports like stockings, and also some simple exercises such as the ankle toe movements, and also some range of movement exercise, some blood circulation exercise to the lower limbs. So these exercises and also stockings are going to prevent these varicose vein, and also some supportives. So especially these the uvular varicosities. So here also for the legs, we are going to give the stockings to the legs. But if anybody get this uvular, especially in the vaginal region, the varicose vein, so we have to give some supportive like straps, that is the uvular varicose supportives. So these are going to prevent some serious complications during the pregnancy. And also because of the weakness of the pelvic floor muscles, so it may chance to get the urinary incontinence. So how to prevent this pelvic floor dysfunctions? So with the special exercises. So these exercises are called as the Kegels exercise. So especially who are having this pelvic floor weakness, so may chance to get the stress incontinence. They're unable to hold the urine. So the urine may chance to get the leaking from the from the ureters. So that means, so if any weakness, the muscles cannot control the urine. So here, so we have to encourage some special exercise is called as a Kegels exercise. So Kegels exercise is nothing but, so ask them to hold the a urine while doing the exercises. So in this position, bridging positions, so we can give some balls exercise. Just now we saw the gym ball exercise, or we can ask them to hold any pillow in between the thighs, ask them to press the pillow between the thighs, and also ask them to hold the muscle surrounding the vagina and also anal muscles. Ask them to pull these muscles toward the spine. So if they pull the muscles around the vagina and also anus, so it is going to increasing the strength around the pelvic floor muscles. So if the person unable to hold or unable to understand about the Kegels exercise, so we can give some some special devices to improve the pelvic floor muscles strength. So these are some Kegels balls exercises. This exercise is not suitable for all the women. So before giving these exercises, we have to give the proper education to them. So because of not all the women are not going to allow these exercises, because of these a special exercise or some may chance to get some privacy disturbances. So that is the reasons. So we have to give the clear information before giving prescribe these exercises. So if you see these three balls, so different weights of these vaginal weights are going to be used in case of the pelvic floor weakness. So if they are not getting the improvement with the Kegels exercise, so with the bridging pose and with the ball exercises and pillow strengthening, pillow holding, so we are going to use these balls as well as the electrical stimulation to the pelvic floor muscles. So these are not all the women are not going to allow. So that's the reasons. Depends upon the severity. So we have to explain clearly to the mother. So if with the mother consent and also family member consent, so we have to encourage these exercises. So with the beginners, so we are going to give the 40 grams of the weight. And if it is progress, we are going to intermediate 80 grams and also is going to the 120 grams. If you see these balls, so these balls have to ask them to put into the vagina and also ask them to hold these balls with the vagina. So if the mother hold these balls with the vaginal contractions, so that means they are going to hold the balls with these pelvic floor muscles. So it will help to strengthen the pelvic floor muscles. So if you want to improve the strength, if it is increasing the weight, we have to increasing the weight with a moderate, that is 80 grams. If you want, again, if the progression occurs, we can go with the 120 grams weight. So same like our dumbbells, how we are going to use the dumbbells for our arms. So depends upon the strength, we are going to increasing the dumbbell weight. The same thing we are going to use for especially, so the female therapist has to advise to the mother, and also they are going to do these strengthening exercises. In serious condition, if the mother getting the more worse of the weakness of the pelvic floors muscles, so we can use the electrical stimulations. So electrical stimulation, the small electrical, pad we have to insert into the probe, the electrical probe. So this instrument have to use to strengthen the pelvic floor muscles. So this probe have to insert into the vagina, so have to give the stimulations. So at least minimum 30 contractions have to give at one time. So after relaxation time, again, we have to give the 3 sets of the electrical stimulations. So this probe have to insert into the vagina and also have to give the muscle stimulations. So this, if we insert into the vagina, so surrounding muscles are going to be stimulated. The muscles are going to get the contractions. So because of the electrical impulses, the muscles are going to be contract and relax. So because of these changes in the muscles are going to be activated, and also it helpful in the strengthening of the pelvic floors. Other than these exercises, interferential therapy and also bladder retraining programs are going to be helpful in case of the pelvic floor dysfunction. And also in some exercises, just now we discussed, because of the hormonal changes and also the physiological changes, they may chance to get some tightness in the calf muscles and also in the hamstring muscles, back of the thigh muscles. And also they may chance to get the tightness in the hip flexors. So for that reasons, so we have to give some stretches, especially the calf muscle stretching. So wall pushing activities. So if we want to stretch the left leg ask them to bring the back side and right leg forward. So if we bend forward and also here, we are going to get the stretch. So these are the important exercises during the antenatal and also postnatal exercise. So these are helpful to stretching the calf muscles. So if we unable to, if any healthcare provider or physiotherapist or nurses are not available, so ask them to do some self exercises with the help of the foam roller, or help with the help of this towel. So ask them to hold the towel and pull this ankle upwards. So they are going to get the stretch in the calf region. And also with the help of the foam roller, so put the legs on the foam roller, move forward and backwards. So it may give the pressure on the calf muscles. It will help to reducing the tightness in the calf muscles. And also opening in the hip flexors and also adductor muscles if they're having any tightness. So if these positions also going to be improve the flexibility and also to avoid the tightness and also improve the flexibility in the lower back muscles. So this foam rollers for the calf muscles and also the thigh muscles, and we can give some ROM exercise, so ankle toe movements in the supine lying positions, but we should not give more than 5 minutes in the supine lying position. So in the stretchings for the hip flexor muscles, especially for the groin muscles or the groin tightness, so ask them to do in the stretching positions, in the kneeling position, half kneeling position, we can give the stretching for the hip flexor muscles. And also some ergonomics and also postural educations have to give while sleeping, while traveling. So, and also here while traveling, so how to wear the seat belts. So this one is above and below the bump. So if you see here, so if we give these positions, the seat belt over the belly and over the fetus, it may give the discomfort. So that's the reasons we can encourage the belt should be the above the fetus and also below the fetus. So it will stabilize the fetus. So, and also that's while eating, while taking rest, we have to give the proper positions with the half lying positions. The proper placement of the pillow over the back as well as below the knee regions. So these are going to be prevent some like a postural abnormalities, and it gives the more relaxation. While sleeping in the side lying position, we have to give the placement over the neck region, the head and neck, and also pillow between the two knees, and also the knee should be over the pillow. So these positions are going to be the comfortable positions to avoid the stress on the lower back and also sacroiliac joint. It will prevent the back and also sacroiliac joint pains. So while sitting, we have to give some sitting ergonomics. So should not be sit with the anterior pelvic tilt. So we can ask them to sit 90-90 positions. If you see here, the hips and also knees should be 90 position. So these positions, if we maintain, so we can prevent the lower back and also pressure over the abdomen. So if they are not reaching the ground, so we can give a small stool. So ask them to keep below the foot, and also it maintain the 90-90 pose. So it will use the erect posture and also prevent and also back pain and also sacroiliac joint pain. While sitting, and also, so it should be the support with the lower back, and also standing also should be so in the erect postures. So we should not maintain the high arch of the back, and also they should not maintain the hip flexion. So should be in the straight position. If they pick up any object from the ground, so should not bend from the a straight line. So many women, they don't have an idea, so they may bend and also they may chance to get the more pressure so over the lower back. So instead of bending straight continuously, ask them to bend the knees and hips and also squatting positions. So if they pick up any object from the ground in the squatting position, they won't get much pressure on the back, so they won't get any pain. So while taking during the labor, so we have to give some positions for the relaxation positions. So these are especially on the leaning forward on the pillows or chairs, or maybe Swiss ball or exercise ball. So these positions are going to be the relaxation positions. So it will help to like an easy delivery to the baby. So these positions are important during the labor. So it will prevent the like a stress on the lower back muscles, and also it is going to produce the like a more pressure on the anti-gravity muscles. It will help to opening up the cervix and also helpful to the movements of the fetus, and also it will help to easy delivery. So it depends upon the stage, we have to give the positions, and also on the leading to the pillows, and also sitting positions, and also during the third stage, so change the positions in the kneeling position with the support of the any bed frame and also support of the pillow. So these are going to be helpful during the labor. So during the labor, and also we have to reduce some complications. So reduce the common complaints of the pregnancy, such as fatigue, varicose veins, and swelling of the extremities. So we have to give some exercises, relaxation techniques, and also just now we discussed some stretchings and also some physical activities. So these are going to give some relaxation to the muscles. So and reduce the insomnia, stress, and anxiety, depression with the breathing exercise. So before going to the sleep, so if you practice the diaphragmatic breathing exercise, so these breathing exercises are going to be helpful to reducing the anxiety and depressions, and also it will help to the sleep, and also it will help to reducing the insomnia. Weight bearing exercise reduce the length of the labor, and also prepares the women for the physical demand of the labors. Improves the core stability and pelvic floor muscles. Improves the glycemic index. So who are having like a diabetes, so they may chance to get the like a high sugar levels. So if we give exercises, so we are going to reduce the like a sugar levels. So these sugar levels also going to be reduced with the help of the exercises. And also protective effect on the coronary heart diseases, osteoporosis, and also hypertension. So these problems we can minimize with the regular exercises. Decreasing the birth weight and also less maternal weight gain, improves the feeling of the well-being, helps in the achieving the pre-pregnancy fitness levels. So if you practice these exercises, so we are going to maintain the physical fitness, as well as we are going to prevent the health-related complications such as any hypertension and also diabetes during the pregnancy. So when we should not give these exercises. So these antenatal exercises, and also if any patient will get any ischemic heart diseases, and also any rheumatic heart diseases, congestive heart diseases, in these conditions, so we should not give this antenatal exercise. Or in case of placenta previa. So that means if the placenta moves downwards, so we should not encourage the exercises. So it may chance to get the other complications. So that's the reason. So it's absolutely contraindication in case of placenta previa. And also the premature rupture of the membrane. So if in case of any rupture, we should not encourage these exercise. And also pregnancy induced hypertension. So if any high blood pressure, so related to the like a pregnancy, so we should not give these exercises during the antenatal. And also history of the preterm labor. So in case of the preterm labor also, we should not encourage these exercises. And also incompetent cervix. So if the cervix is not closed completely, so if it is open, so it may give the other complications. So these are the contraindications. Any acute infections, thromboembolism or pulmonary embolisms, persistent second or third trimester bleeding, or intrauterine growth retardations. If any intrauterine growth abnormalities, or any thromboembolism, or any pulmonary embolisms, any bleeding during the third trimester, so we should not give these like antenatal exercises. And also relative contraindications are any is a hypertension, or is the obesity, the morbid obesity is more obesity, poor controlled seizure disorders such as any fits or epilepsy, or any cardiac diseases, any severe anemia, twin pregnancy after the 20th week. So if like any twins, so in the third trimesters, so mates, we should not give these exercises. In case of any severe exercise-induced asthma, so we should not give all these exercises. And also during the exercises or during the care during the antenatal. So when we should stop the exercises immediately. So that means in case of any shortness of the breath, sometimes may chance to get the postural hypotension or sometimes dyspnea or any altered heart rate and also heart function, immediately we should stop the exercise. Any chest or any palpitation, chest pain or any palpitations, so any discomfort in the chest or any altered the rhythm of the heart functions, immediately have to stop the exercise. Painful uterine contractions, if they get any contractions, or any pre-syncope or any dizziness, any vaginal bleeding, excessive fatigue, abdominal pain, reduced fetal movement, a leakage of the amniotic fluid. So immediately we should terminate the exercise program. Coming to the next one is the how to give the exercise prescription in the pregnancy. So how much of time and also what is the frequency and repetitions. So what are the exercises? So we have to give encourage the aerobic exercise and also walking and swimming exercise. So these should be at least, so it's going to be helpful for the increasing the 60 to 70%. So who are having sedentary lifestyle, so if we encourage the walking, swimming and aerobic exercise, so we are going to improve their fitness levels. And also who are in the sedentary lifestyle, we can give the mild to moderate exercises. So who are already fit, so we can give the maintain the fitness during the progression until the 60 to 90%. So we can encourage them to do the exercise, so depends upon their fitness levels. So if they are more sedentary lifestyle, we can give the only mild aerobic exercise. So then if they're getting improvement, so we can encourage the exercise levels. So depends upon their dyspnea levels. So while doing exercise, so they may chance to get the difficulty in breathing. So for them, we have to check some scale, that is the Berg's scale. So depends upon their exertion. So we can prescribe the exercise protocol for depends upon their fitness levels. So in the flexibility exercise, how to give, and also aerobic exercise and resistance exercise. Flexibility, we have to give the 10 to 20 seconds and also each exercise. So this one is at least 2 to 3 days. And also then we can give the aerobic exercise. So if they get the improvement, so we can go to the resistance training with the simple dumbbell exercises. So these exercise we can encourage during the antenatal period. So how much of duration and frequency we have to encourage during the antenatal? So starting with the 15 minutes and progressing to the 30 minutes. So we can encourage every day, at least start with the initial who are maintaining sedentary lifestyle. So we have to encourage from the 15 minutes to the 30 minutes. The minimum 3 times a week. So we have to encourage 3 times a week. So then we can progress to the 4 to 5 times. So, but before the exercises, and we have to give the warm-up sessions. After the exercise, we have to give like a cool down exercise. We have to take the precautionary measures like a breath holding, and also like a frequent water intake and regular breaks. If they get any dyspnea or any dizziness, immediately they have to stop the exercise. So these precautionary measures we have to maintain during the exercise. So what are the guidelines for the exercise in pregnancy? So first, before the give the exercise, first we have to examine the mother. So what are the physiological changes, any pathological changes or any diseases, any hypertension, any heart diseases, and also any diabetes, or any any abnormality in the muscle or any posture, we have to identify. Then according to the assessment, we have to prescribe the exercises. So we should not give any jerky movements or any bouncing activities. We should be avoid. It may give the discomfort to any ligaments, because of the ligaments are relaxed and may chance to get the hypermobility. If they get any any exercise, we should give the warm-up session and cool down sessions. And also heart rate should not be increasing more than the 140 while doing the exercises. Do not overextend, overstretch the joint, or rapidly change the direction. We should not give the pivot directions, sudden turning and sudden stretching exercises. it may give the overstretch and also may chance to get the joint pains. Avoid the Valsalva maneuver and also contact sports. If any contact sports, any jumping activities, we should not encourage. We should not give the more pressure. We should not encourage the breath holding. And also these exercises are very important. No prone position after the first trimester. So prone lying. So because of the baby increasing the first trimester until the first month to the third month, we can give some slightly side lying and prone lying. But after the baby growth, we should not encourage the prone lying positions. And also avoid exercise in the supine lying positions after the 4th month. It may give the pressure over the abdominal vessels, especially the inferior vena cava. And also next one is, we should give the more precautionary measures while giving the supine lying exercise with the help of the small towel roll at the right side hip region. So we can give the, so no pain, no gain does not apply. So here, not like normal people. So we have to consider this as special people during the pregnancy. Fluid must be taken before, during, and after the exercise to prevent the dehydration. Always maintain the hydration. Empty bladder before exercise and also avoid the gastrointestinal discomfort. So eating at least 1 hour prior to the exercises. So we should not immediately give exercise after intake of the food. Any strenuous exercise should not give, and also horseback riding, gymnastics, cycling during the pregnancy are not allowed. So these are the some challenging exercises, challenging sports we should not encourage during the antenatal. So what is our role during the postnatal care? So postnatal care is important after delivery. So because of the some complications. So these are introducing exercise and also relaxation program, thereby assisting in the new mothers in the physical recovery. So they are going to change so many changes. So, and also restoration of the muscle strength and tone. The muscle tone going to be altered. Tone is going to be like a lax. The muscles are going to be weak and also loose. So we can bring back them into the normal tone. So with the regular exercise. Treatment of the musculoskeletal problems, correcting the ergonomics for the breastfeeding. While giving the breastfeeding, they are going to handle the baby in the wrong direction. So they may chance to get the again postural back pain and also mid back pain and also interscapular pain. Providing support and counseling and also helping cope with the stress. Education regarding the importance of the postnatal exercise and also breastfeeding. So during the breastfeeding, they are not going to maintain the postural ergonomics, so they may chance to get the other complications. So if they get the normal delivery, after normal delivery, we are going to encourage the limb movement, especially the ankle toe movements, exercise for the lower limbs. So including the breathing exercise and also pelvic floor exercise. So for the lower limbs, we are going to encouraging the heel slides. So ankle toe movements and heel slides. Ankle toe movements means ask them to do the ankles up and down. So these are going to be increasing the blood circulation in the calf. So why this is going to increase the blood circulation? So the calf muscles are nothing but peripheral heart. Our heart is functioning, pumping the blood from throughout the body. In the calf muscles also, this gastrocnemius and soleus muscles are going to act as a peripheral heart. Peripheral means outside the heart. So these are going to increasing the pumping action in the lower limbs. And also heel slides are going to be increasing the knee flexion and also hip flexion extension exercise is going to be improving the blood circulation in the lower limbs. And deep breathing exercise, pelvic floor exercise are going to be increasing the strength in the breathing muscles and also the pelvic floor muscles. So these pelvic floor muscles we are going to do in the supine lying positions. So we are going to encouraging with the ball exercise, pelvic bridging, the modified pelvic bridging, advanced pelvic bridging, and also with the lower legs, we are going to use some therabands, like a resistance bands. So these bands we are going to use, push the open the hips. So these bands are going to give the resistance. It will improve the strength in the lower legs. And also pelvic tilt, gluteal set, and knee to chest exercises. So these are going to be increasing the flexibility in the muscles. And these exercises are going to be maintain the muscle properties. So improve the muscle length and also it maintain the, which if the muscles are like a length, loose, so we are going to be strengthen the muscles. So these are the cat and camel exercise. So these muscles are going to be helpful in is relaxing the lower back muscles and also improve the flexibility in the lower back muscles. It prevent the tightness and also prevent the lower back muscles and the lower back pain with the cat and camel exercises. And the single leg raising exercises. So these exercises are going to be like a stretch the hamstring muscles and calf muscles and improving the like a blood circulation in the lower limbs. And also abdominal exercise, the abdominal curls in the supine lying positions. So these are going to give the isometric contraction to the abdominal muscles. And also bridging exercise also going to be strengthen the lower back muscles and gluteal muscles. It will help to improving the strength in the buttock region. So it will improve the core strength. It will prevent the postural abnormalities. And also, especially the ergonomics, we have to encourage the ergonomics. And also we have to teach the proper postural ergonomics. While sleeping, they have to keep the support pillows at the head and neck region and also support to the abdomen region. While carrying the baby, while lifting the baby, just now we discussed, they should not lift directly with the back bending. So they are using the lower back muscles, the big muscles. So that's the reason they may chance to get the back pain. While changing the like a nappy, while lifting the baby, they should take the like a kneeling positions or also squatting positions. So these positions will avoid the pressure over the lower back and also stop the back pain. So, and coming to the breastfeeding positions. So ergonomics during the breastfeeding. So if you see here, if the mother is not support properly during the sitting positions or then the lying positions. So lying, so at least the mother has to pull the baby towards the like a breast. So then only they can maintain posture and also prevent. They can get they can avoid the pressure in the mid back and also shoulder blades. While maintaining the sitting positions, if they hold the baby close to the mother breast and also with the help of the back support and also knee and also foot support, they can maintain the ergonomics and also they can prevent the pressure in the shoulder blades and also can avoid the and also mid back pain. While giving in the sitting and also long sitting positions, they can put the pillow between below the knees and also below the foot also is going to maintain the 90-90 position. The body is going to be erect. The hips are going to be 90 positions and knees are maintained the 90 positions. So these positions are going to be helpful to prevent this abnormality in the posture. And also during the carrying, so and also have to maintain the posture with the support and also with the any like a support to the baby with the brace or with the rollators or maybe this stroller. They can support with stroller. They can maintain their posture. Otherwise, if they lean forward, again they may chance to get the lower back pain. So while changing the nappy, so better you can give in the standing position. The level of the table should be up to the pelvic regions. If their table is very low, if they bend, they may chance to get the back pain. So if they maintain these simple tips, so we can avoid some postural back pains and also postural abnormalities. So coming to the next one is the exercise sessions and also physiotherapy following the Caesarean delivery. So until now we discussed about the normal delivery, but in the Caesarean delivery, so we have to give some precautionary measures. So because of the opening, the incision, so they may chance to get some severe complications. So and also movement also made difficult. So we have to encourage them to how to roll, how to sit after the surgical procedure. So we have to give any like a pain related symptoms we can give for the TENS applications and also diaphragmatic breathing and also segmental breathing. So ask them to breathe properly and also abdominal protrusions. So while giving the diaphragmatic breathings, so we can ask them to stabilize the incision area. So incision area, we can give the support with the hands, ask them to stabilize and also breathe in and also breathe out in the relaxed manner. So they should not be do like in the fast manner. So it should be in the relaxed manner. During the coughing or if they get any cough or have to stabilize the suture area with a pillow, with a hand support, then only they can cough. So they can prevent any disturbance in the a suturing area. So if they're getting the improvement after suture removal, after reaching the a 2 weeks a period, so we can encourage them to the activities surrounding to the bed, simple activities such as the rolling towards one side, right and left side, and also heel drag and also knee drag. So here is going to be, we have to encourage these exercises. So these exercises are going to be increasing the blood circulation in the lower limbs. So if they getting the improvement in their physical strength, so we can encourage them to the pelvic floor exercise, pelvic tilt in the bridging pose, and also move forward and ask them to move forward and backwards in the supine lying positions with the bridging movements. So these exercise, so from the supine lying to the bridging pose, again in this bridging pose, ask them to tilt the pelvis to right side and left side, anterior tilt and posterior tilt. So these are going to be helpful in controlling the strengthening in the pelvic floor muscles and also abdominal muscles. And also if they are getting improvement, so after the 1.5 months to 2 months, so we can encourage the a vigorous exercise such as the core strengthening exercise, abdominal curl exercise, advanced abdominal exercises. We can encourage after the after the 6 to 8 weeks. That means after the 2 months. So these exercises are very important. These core exercises. So ask them to do these positions in the sitting on the ball. So moving forward and backward. So that means sitting on the ball. Ask them to move forward and backwards. If we sit on the ball, simply sitting also is going to activate the core muscles. It will help to strengthen the abdominal core muscles. It will help to strengthen and also the posture. And also here is the maintaining the plank pose on the ball. And next one is we can encourage them into the lifting of the leg in the Superman pose with the help of the ball. Altering the positions. So these are going to be without support. Ask them to raise the a head and also upper shoulders. So these are going to be strengthening to the back muscles who are having the a weakness in the back muscles. So these are going to be helpful to strengthen the lower back and also core muscles. If they're able to do with without keeping the hands on the a head, so next progression we can ask them to hold the neck region. So this is a bit the difficult task. We have to increasing the mild to moderate. If they are getting the progress, we are going to give the advanced training. So then the pelvic bridging. Without ball first, initially start with the without ball. Then we can encourage with the with ball. Then we are going to encourage with the knees bending. So this is the advanced a bridging positions. So these exercises are going to be helpful in prevention and also in the weakness, as well as improve the strength in the lower back muscles, as well as is going to strengthen the pelvic floor muscles. So coming to the next one is just now we discussed about the diastasis recti, so oblique strength and also abdominal strength exercise. After getting the improvement after 2 months exercises, so these things we have to encourage. So these exercises are
setting up WhatsApp on your Android phone before leaving this page. Jangan cancel, resume saja.
Ya,
Biar
saja ya.
Okay, so these exercises are important. These 13 exercises are
wireless Nita.
Wireless apa?
Wireless.
Can you mute Dr. Lina?
Ada wireless. Jangan pakai wire. Ini
Dr.
jangan
Lina,
dicabut
can you
ya.
mute? Can you mute?
Hello.
Yeah, can you mute? Last slide.
Sorry.
So next one is the exercise, advanced exercise to strengthen the abdominal muscles and also the oblique muscles. So these exercises are very important. So first one is the side plank. So here you no need to give any equipment. Without equipment, just ask them to maintain the side plank position. So side plank with the help of the opposite hand. So they have to take up the hand support, elbow support, and also feet support. If they maintain, so they are going to activate the core muscles and also strengthen the abdominal muscles. So with these positions, oblique muscles are going to be activated. It improves the strength in the oblique muscles and abdominal muscles. So first we have to initially start with 10 seconds, ask them to hold 10 seconds. If they are getting the progressions, so we can increasing the duration of the holding positions from 10 seconds to the 15 seconds. So then we can increase until the 30 seconds to the 1 minute. So if you give the advanced training, then we can change the positions from the side planks to the side plank dips. Side plank dips means in the side planks, they have to come down. So from their come down, they have to ask them to lift it up the body. So away from the ground. So these things, they have to lift it up and also bring it down. First, initially, depends upon their strength. Initially start 5 to 10 repetitions. Then we can slowly increasing the repetitions and also holding the duration. Then we can ask them to do is going to the sit up to the twisting. So in the crook lying positions, so bending the knees and also bring the elbows close to the opposite knee. So twisting, sit up and curling position and also twisting from this position to opposite knee. So these are going to be activate the iliac obliquus muscles and also abdominal muscles is going to be strengthen the obliquus muscles. And also Russian twist. Russian twist is nothing but ask them to maintain the balance in the buttocks and also ask them to raise the heels from the ground and also then ask them to move towards the right side and also left side. So this position, so that means they have to hold the positions. The core system is going to be activated and also twisting to right and left side is going to strengthen this abdominal, this side flexor muscles. So these muscles are going to be strengthened. So towards the right side and left side. So next one is the Spider-Man. So Spider-Mans are nothing but how the Spider-Man is going to walk. Same in the positions. So that means ask them to plank pose. In the same position here, ask them to this leg towards the wall, towards here, and also then bring it back and ask them to do the forward and backwards. So one leg front, another leg. So plank pose like a Spider-Man, how the spider walk. Move forward and backward, then bring it back. And coming to the trunk rotations. So in the supine lying position here, the trunk rotation, ask them to both legs towards the left side and also right side. So these are going to activate the obliquus muscles. So if they are getting the progressions, so if they're able to do this one, so we are going to encourage like a wood choppings. That means with the help of the ball, with the help of the dumbbell. So ask them to bring it towards left side and stand up and bring it towards right side. Squatting to the stand and bring it left and right. So these are, so if your trunk if your movements are if their trunk is functioning properly, if your muscles functioning properly, we can carry the weight towards left side and we can carry the left. Weight is nothing but you are doing some exercise. So these exercises are going to strengthen the muscles. So same like we have to give. So if you see this medicine ball means the ball is going to be heavy bit. So depends upon the weight, 5 kg and 10 kg, 50. So depends upon their capacity, their caliber. So we are going to give the weights. After that, we are going to give some dumbbells. So lean towards the left side and right side with the weights. So if you're bending towards, and this one is, these muscles are going to be strengthened. So after that, after this, if depends upon their strength. So we can ask them to do some forward lunges. So standing with the weight ball, the medicine ball, and also step forward lunge position, ask them to the rotation to left side and ask them to go to the right, rotation to the right side. And also next one is the standing side crunches. So standing, we can ask them to keep the hands on the head. So ask them to lift up, ask them to lift the head and try to touch the elbow. So the knee and elbow should touch. So this side crunch, this side is going to be more strength. So after that, so we can ask them to the side kicks, squatting position and stand up and side kick. So these are going to be helpful to strengthen this abdominal muscles and also crunches and also these oblique muscles. Then we can ask to the power hooks. Power hooks means to the kicking to the upside and middle and also downside. So we have to change the directions of the kicks. So different positions. So different muscles are going to be activated and also is going to be helpful to improve the strength in the muscles. So these are the basic one, but depends upon the person to person. If the person having for example, more fat in the tummy, so we have to concentrate on the tummy exercise. If the fat around the thighs, so we have to concentrate or in concentrate on the tummy exercise or the thigh exercise or the buttocks, or sometimes the arms are going to become bigger size. So the tone is going to be lost, right? So it depends upon the symptoms where they're having the problems. So according to their symptoms, we have to plan the treatment. All the exercises, all the treatments are not same to all the women. So it will be different to each woman. So we have, according to their symptoms and also their complications, we have to concentrate on the exercise. If it is back pain, we have to concentrate on the back pain. If, for example, SI joint, we have to concentrate on SI joint. Any varicose vein or any postural abnormality, any like a only abdominal diastasis recti. So we have to concentrate on the condition. So according to their problem, so we have to give the exercise protocol. So that's all about the basics of the antenatal and postnatal exercises. Actually, this course normally takes, the full course will be the 2 to 3 days sessions. So each session, each trimester, how we are going to give the exercise. So what are the exercises in the first trimester and also second and third? So what is the initial period of the postnatal period? What are the exercises? And also what are the exercises in the in the advanced condition? What are the exercises? So normally we have to explain about discuss about all the system changes. So normally we can finish this one will be 2 to 3 days full like a training session, antenatal and postnatal. If it's possible, we will try to in the further sessions. So today my topic is going, and that's all. I'm going to stop here. If you have any doubts, you can raise the questions. I can clarify your doubts. I hope you understand clearly. Okay, if you have any doubts, please raise your question. Thank you very much.
Terima kasih Dr. Ravi. Thank you so much Dr. Ravi for the very initiative, inspiration speech. Any questions? Ada yang mau bertanya? Ada yang mau bertanya? Boleh ditanyakan langsung atau boleh dituliskan di dalam chat box to Dr. Ravi kalau mungkin ada yang ragu-ragu atau mau ditanyakan lagi.
If you have any doubts about the exercises, you can go through my YouTube channel. You can get all the exercises. Maybe I can share my YouTube videos, details. All the exercises, this exercise, plank exercise. So all the exercises are there. Maybe you can, I will share to Dr. Lina. Maybe she will share all the details if you want. Yeah, Yuna, Miss Yuna, yeah.
Okay, can I ask to Dr. Ravi Kumar Kata?
Sure, yeah.
Okay. My name is Yanuan bin Olina. You can call me Olina, my last name.
Okay, Miss Olina, yeah.
Yeah, I want to ask some issue. Actually, this issue is not you mentioned in your slide, but I wanna learn about this.
Sure.
It's about a woman's age that can affect the pregnancy, especially in the first pregnancy. Previously, I just finished study in Taiwan, and I learned about culture and Taiwanese habits. And the first pregnancy in Taiwan is the average is around 32 above. So it's I want to ask about what we need to be prepared to prevent complication during pregnancy at this age, because we know the age can affect the pregnancy, especially if the age is too old, and maybe we need to prepare special exercise. And mostly in Taiwanese, women are delivered by C-section because the age issue. If they want to normal delivery, what exercises are good to prepare to reduce the risk factor during the pregnancy and labor?
Okay, thank you. I think it's a very good question.
Yeah.
So actually, this complications depends upon the age factor. If the age grows, for example, after the 40 also, many women are getting pregnancy. but after crossing the 40, so the complication will be more. So initially, for example, in the 30s, early 30s, so the pregnancy will be, complications will be less. But if it is crossing, if increasing the age, the complication will be more. So, for example, because of the hormonal imbalance and also the changes of the hormones will be different according to the age factor. So that's the reasons. So better in between the late 20s and also early 30s is the best period for the pregnancies. And also coming to the, you're asking about the how to get the normal delivery if they want to go for normal delivery. So normal delivery, just now we discussed. So antenatal period is the very crucial period to avoid the complications. If they are regularly practicing the exercises, so all systems are going to be functioning properly. So that means musculoskeletal system, okay, and also especially the hormone system, endocrine system. So all systems are going to be the neutral. So that means can maintain the muscle properties and joint properties and also hormonal functions. So that means hormones are very, very important. So these hormones plays an important role during the delivery. So if any alteration of the hormones, so it may, they won't, sometimes they won't get any labor pain. So directly, no pains, so automatically they can go for the surgical incision, that is caesarean surgery. So if they continuously from the throughout the pregnancy, regularly, weekly thrice or twice, and it's at least the 30 minutes of regular exercise, so they can maintain the hormone functions. So these hormones are going to be helpful during the delivery, that is oxytocin and also relaxin hormones and progesterone hormones. So they're going to maintain the neutral position, normal position. So that means, so it will help to releasing the like oxytocin during the pregnancy. It will help to contraction the uterine function. So it will help to uterine contractions so they can get the normal delivery. So that means regular the pelvic floor exercises and also the muscles around the like a lower pelvic regions. So these exercises are going to be to maintain the like a strength in the pelvic floor as well as relaxation also. Just now it is during the labor, so we have to give some relaxation positions. So these positions and also regular exercises, weekly twice or thrice exercise, are going to maintain the fitness levels. So it will help to improve the normal delivery process. Who are like a anxiety or depressions, so they won't get the like a uterine contractions, or they're going to try to hold. So those muscles are going to be tight. So no relaxation. So that time they won't get any normal delivery. Or in case of, for example, if they're having any health issues, diabetes or overweight, so very difficult to get the normal delivery. So if they do regular exercises, we are going to maintain the high blood pressure and also diabetes and also weight gain also we are going to minimize. So those people may chance to get the like a normal delivery. If they get complications related to the diabetes and also obesity and weight gain, so they won't get the easy like labor process. So those people they have to go for the surgical incisions, that's caesarean delivery. So that's the reasons before going to the delivery, they have to know the what are the breathing exercise, relaxation techniques exercise, and also the pelvic floor exercises and opening exercises. Opening exercise just now here. So these are simple exercise. So we have to give this is the sitting squatting position and also stretching of your hip adductor muscles. So this exercise and also stretching exercise are going to simple stretching exercise going to be helpful in the helpful for the normal delivery, like a squatting exercise and also pushing and pulling exercise. In the squatting position, ask them to hold the like a tightness, like a breath, holding the tummy close to the spine, like an abdominal strength exercise, and also holding the urine. So these exercises are going to be like a stimulate these muscles and will help to the normal delivery. Is it clear? Your doubt?
Yeah, it's clear. Can I ask more question?
Sure, no problem.
Yeah. There is any device or tools to measure muscle strength? I know
Yes.
in my school there I have something like some machine to measure muscle strength, but it's only for sport. I don't know. It's can for pregnancy woman.
Excellent question here. So here, here we are going to check the manual muscle testing. There is no exact instrument for these muscles. For example, if you understand about the manual, some scale is there, manual muscle testing. So for example, if you want to check the abdominal muscle strength, so here grade 0, 1, 2, 3, 4, 5. Total 5 grades are there. The first grade is, if you want to check the muscle contraction, okay, I'm mentioning the biceps. So this is the arm muscle. If you palpate here, normally, who are the like a muscle weakness, you feel like a very spongy, very slim. There is no tension in the muscle. If you ask, no contraction, no movement. Contraction means at least you will get the muscle contraction. Okay, so that is a 0. If the grade 1 means, so you have to feel the contractions. If you ask the movement, at least they will get the some contraction, flicker contraction. That is a grade 1. Grade 2 means, so now I'm a normal person. If you ask the movement, I can do the movement in my elbow. So this is my full movement. So my muscle functioning. So that is the grade 3. If, for example, I unable to do this movement against gravity, full range of movement against gravity. So that is the grade 3. Grade 2 is full range of movement. They are unable to do in the against gravity. Only they do in the anti-gravity. Gravity eliminated position. For example, I unable to do the direct movement, but if I sleep, I can do only this is the gravity. I unable to do the against gravity. Grade 4 means against full range of movement against gravity with a minimal resistance. If someone give the resistance or if we give any weight also, I'm going to do the movement. Grade 5 means maximum resistance. If someone stop also, I'm going to do the movement. That is grade 5. So always this scale, this measurement scale, we can use everywhere for all the muscles. When you can apply, if you know the muscle action. For example, for abdominals, okay? If the person is supine lying, if you ask them to get up from the supine lying to sitting position, if they get up, their muscle power is 3. Their muscle power is 3. They are getting using the muscles against gravity. Some people, they are unable to do the supine lying position sitting, but they can turn one side, side lying. They can side lying position they can bend their knees. So that means they're pulling the knees to the chest. They're lying, they're pulling the knees. So that is, they're doing the gravity eliminated position. They're not doing the against gravity because weakness. Simple test. Okay. The person is supine lying. Just ask them to raise the both legs from the ground, from the bed, only half, like if one fist, 5 centimeters. Just try you all here. You go and check your strength. Ask them to lift the both legs at one time. Only 5 centimeters from the ground. How many people are going to do this one? Who are having strength, they can hold 5 seconds to 10 seconds. Who are having muscle weakness, they are unable to lift the legs, both legs from the ground at a time. You go and check after this one, after this session, you go and observe. And also the same thing we can ask them to 10 degrees, 15 degrees. This is the grade 3. Grade 4, ask them to put the hands here, ask them to get up from the bed without support, keeping this one. This is the grade 4, minimal resistance. Grade 5 for the abdominals, ask them to keep the hands here in the supine lying position. Ask them to get up from the bed. Okay, without support, keep the hands here. This is the grade 5. Who are having perfect strength, so they can only get up from the bed with the hands on the head. This is grade 4. Okay, just simply we can ask them to put the hands forward, ask them to get up from the supine lying to sitting position. This is a grade 3, grade 4, grade 5. So these grades, if they understand the manual muscle testing, this scale name is called Oxford Grading Scale. You go and check in the Google, Oxford Grading Scale. So this scale is used to measure the muscle strength. We called as MMT, manual muscle testing. For this one, no need to use any muscles, like any tools to check the muscle strength. We can use for the strength dynamometry, for the strengthening for the grip. Some equipment is there for the hand grip. We can check. We can check some weight lifting for the legs, but we are not going to use these equipments for the abdominal muscles. Is it clear?
Yeah, it's clear. Thank you so much, Dr. Ravi Kumar. I really appreciate your explanation. Thank you.
So a very good question, actually, this one.
Yeah.
Okay. Yes. Prof, any doubts here? Someone is raising the hand.
Oh yeah, thank you. First thing first, thank you, Dr. Ravi, for the great presentation. Let me introduce myself. My name is Alvin. Okay, here I have 2 questions.
Yes, ask me, please.
Okay, first question. From the presentation, I saw that there's a gym ball for pregnancy. As we know that not all pregnant women having this pregnancy ball to do yoga to train the muscle. So what we can give or how we can modify the ball, or maybe is it enough with the other exercises that doesn't need the ball? Second question, what is the most impactful exercise according to all the exercises that have been mentioned in the presentation to maximize the function of lower muscle? Thank you, Dr. Ravi.
Okay, right. So here, no need to use all the women's, and they no need to get these ball exercises. Who are having a muscle weakness, especially in case of lumbar, especially for the abdominal muscles. So, and also tightness of the lower back muscles. Here we cannot do the normal exercises like a back pain exercise for the normal person. Here in the back, just now we discussed after the 2nd trimester, after the 4th month, we should not give all the exercise. We should not give the prone lying. Normally, if anybody get back pain, to strengthen the back, normal exercise, the prone lying. We can give the prone lying exercise, lie on tummy, and also push the body up. But here, we cannot give these exercise for the pregnant women. So that is the reasons. So we can give the pelvic tilting exercise. So without ball also, we can give the pelvic tilting exercise, but they have to understand how to tilt the pelvis. So here also, in this position also, in the supine lying position, and also here, we can do the lifting the pelvis and tilt the pelvis left side and also right side, and also up and down. So these pelvic tilt sessions we can give, but with the help of with the help of the ball, it's easy to give these exercises. Without ball also, in the standing positions, we can give the side like a pelvic hike and pelvic like a lift. So these things we can give, but with the ball, the effects will be more, and also easy to do all the exercises. If it is not possible to get all these ball exercises, they can practice on the floor without the help of the ball also, and also maybe they can use the pillow, and also with the help of the caregivers or family members, ask them to put the pillow down. Just the ball is going to be helpful, give to support to the legs, and also it maintain the bridging pose easily. So that's the reason this ball exercise is easy to maintain the posture. If it is not possible, they can do in the lying position, they can do in even standing position also. In the standing also, they have to rock the pelvis, move forward and backward. That means they have to push this pelvis forward and backward, but maintain the posture properly. If for example, who are having difficulty even doing exercise, if they simply sit on a ball also, automatically the core muscles will get activated. So that is the advantage of the pelvic floor. That is advantage of the ball. And also without doing the foam roller also, just now I shown the one roller, we can use these exercises. So this without foam roller also, we can do some exercises, but with the help of some physiotherapists or nursing caregivers, but someone should be there. But with the foam roller, without help of anyone also, they can do their muscle stretching, and also they can release the muscle tension, They can reduce the complication without help of any other person. So that's the reason without tools and with tools, the advantage will be different. But with like a proper advice from the physiotherapist, they can get the more benefits. That means, for example, they're unable to get the ball and also foam roller or any other equipments. Simple exercise and modifications are there at home. So they can give according to their availability. If they get information from the physiotherapist, it will be good and also the benefit will get more. Is it clear? I hope you understand. I got the information. Am I gave the clear information?
Yeah, it's clear enough, Dr.
Ada lagi pertanyaan yang lain? Is there any questions from the students? Any questions?
Okay, I share in the chat box. This is the videos, the exercise videos. You can go through related to some exercises, especially the tummy strengthening exercises. So these some ball exercises, medicine ball exercises. So this is my YouTube link. Maybe I can share. I share here. You can go through if you are interested. Some exercise related to the ball exercises, crunches, and also this plank exercises for the tummy strengthening. These exercises not only for the antenatal and postnatal, who want to reduce their tummy, especially who want to slim, who want to fit, so they can if they practice these exercise, so it will help to reduce their tummy and also gives the shape to the tummy and thigh and buttocks region.
So means, Dr. Ravi, you are telling that when they go to YouTube, they can just type the Dr. Ravi's Health Lab. They
Yes.
can see all the videos of yours, yeah?
Yeah, all videos. Some videos are related to the academic, all the subjects are there. Some exercise videos are there. You can check what exercise maybe. Thank you very much. Okay, I think you raised good questions, Miss Olina, yeah, and also Miss Rosida. Is there any other questions?
Is there any other questions? If not, I think that we are closing. We are going for the closing. So, tidak ada pertanyaan lagi. Kalau tidak ada pertanyaan, kita close session daripada Dr. Ravi. Ya. Oke, Lina closekan session daripada Dr. Ravi. So, thank you for Universitas Semarang, all the students, and Dr. Ravi Kumarkata for being here today. This Universitas Semarang is our collaborations partner. So thank you for the time, very patient of Dr. Ravi sharing the information with the workshop of antenatal and postnatal physiotherapy. Together we grow, coming together is a beginning, keeping together is a progress, working together is a success. Thank you very much, Dr. Ravi, and all of the students and all of the staff. Terima kasih.
Thank you for your cooperation.
Jumpa lagi, matur nuwun.
Thank you very much, Dr. Ravi Kumarkata.
Thank you all. Thank you.
One more, Mr. Ravi. I think you need to put in the group chat probably your email and your phone number in case they want to have a chat with you and get anything.
Can I? Okay, I'll give here.
Yes. Pada mahasiswa dan kepada tamu-tamu terhormat dan staf-staf daripada Unimo Semarang, Dr. Ravi akan memberikan kontak number dengan email dia. Sekiranya kalau misalnya mau bertanya lagi ke depannya atau ada masalah yang mau ditanyakan, boleh langsung ke Dr. Ravi. Ya, terima kasih. Jumpa lagi. Sampai jumpa di Malaysia.
Okay, Ravi Kumar is R is a small letter. Sorry. Okay. Thank you all. Thank you very much. If you have any doubts, please communicate anytime. No worries about the antenatal and postnatal.
Sure.
Okay.
Thank
very
you.
much. Thank you.
Bye-bye.